Hi, everyone. My name is Garang, and I'm the founder of Violet. Prior to building Violet, I spent 4+ years building Oscar Health, which is a health insurance company built from the ground up. And at Violet, we're focused on improving access to culturally competent providers. For context, I am a gay immigrant myself, and I've had numerous instances where the doctor really just was not culturally competent, where I felt like I knew more or I trusted Google more than what the doctor knew about serving a queer client. And then similarly, it's just detrimental where after having a few of these instances, I kind of lost faith in our healthcare system. For our solution, we're building a platform that will actually build a credit score for cultural competencies for clinicians. And so what this looks like is we partner with hospitals and provider networks. And with each partnership, we evaluate a subset or all of the clinicians that they employ. And our evaluation looks at many factors, again, very parallel to a credit score. So we look at where clinicians have worked. We know if they worked at community centers or centers of excellence, they tend to be better. We look at overall what education and training they've consumed. We also look at lived experience, which to me is really important. We know historically this was the main factor that was used, but frankly, that creates segregation. So for us, it's a part of the formula, but it's not the only factor that matters. But we do know that providers that have shared lived experience with their patients tend to be a bit more empathetic with those patients. And then the final thing we look at is preferred patients. So we actually ask every single provider if there are specific patient populations they really want to work with. And then cumulatively using this data, we derive badges, which would then be that credit score, which these badges are then surfaced through insurance company rosters and third parties like ZocDoc, where they can actually, users and patients can find providers that are best for them. To share an exact metric, we're sustaining about an 87% retention rate at day 60 of care, which far exceeds what the industry standards are. So Talkspace and BetterHelp, fairly well-known mental health providers, they tend to benchmark at 35% for day 60. And then to share really what our vision or the future looks like is we want to be the singular source of truth or the one platform for cultural competency credentialing. So if it's a parent of a queer youth who's also an individual of color, and if they're looking for a therapist, they should be able to open up their respective insurance application and in their search and filter for a therapist that can speak to both BIPOC intersectionality and queer youth identities.